Hi, and welcome to today's clip of Talking Tinnitus presented by Lanier. Today's topic is what is tinnitus? And we're joined by a special guest, Dr. Beth Field. Beth is a certified tinnitus practitioner and audiologist. She has a degree in audiology from the University of Cincinnati. She's currently a technical support expert for Lanier certified tinnitus practitioners and is a member of the American Tinnitus Association's Tinnitus Advisors program. So I'm delighted to have Beth join us. Beth, you're very welcome to the show.
Thank you, Neil.
So we're asking what is tinnitus or what is tinnitus, as some people pronounce it as well. So Beth, what is it?
Great question. So, tinnitus or tinnitus, both are perfectly acceptable pronunciations of the word, is the perception of sound when there isn't an environmental sound present. So, there's brain activity in the hearing center of the brain that is processed as sound, but it actually isn't sound. And so, tinnitus is typically the brain's way of indicating that your hearing system has become less responsive to external sounds. And for some people, that might present as hearing loss.
Okay, interesting. So there's probably some nuance in different causes and things like pulsatile tinnitus, but for the majority of people, tinnitus is brain activity responding to something that's impacting the hearing system, I suppose.
Exactly. And so today, our focus is going to be on what would be considered sort of the traditional subjective tinnitus, whereas pulsatile tinnitus usually is related to a physical condition or a medical condition that can be treated medically and resolved either through medication or surgery. But the tinnitus that we're talking about today is the subjective tinnitus that is typically related to damage in our auditory system that can't be quickly resolved through medication or surgery.
Interesting. And I think my understanding is that for subjective tinnitus makes up the large and vast majority of tinnitus cases, maybe more than 95% of such would be subjective, I think. Is that
Yeah.
correct?
Yeah. So most cases are this subjective type of tinnitus. Um, and, you probably have experienced tinnitus at some point in your life, Neil. Most of us have.
Yeah.
For many people, their tinnitus may be short term, after a loud event like a concert or fireworks display or a quick illness, viral infection or a cold. But for some people, their tinnitus can be a long term and maybe even a permanent condition that can dramatically affect their quality of life. And I think you were talking about, percentages before. What we recognize in the data is that 15% of the global adult population experiences this long-term subjective tinnitus.
Wow. Okay. So that is very prevalent. That's a lot of people, right? And I
Yeah,
think
it is.
one of the common descriptions people have for tinnitus is ringing in the ears. But I don't think it's like that for everybody. Different people may experience it a little bit differently. I think, right?
Right. And so, every so often someone will say, I don't know if I have tinnitus because people say it sounds like ringing in the ears, but mine sounds like, and they'll describe how their tinnitus sounds. I've had one gentleman who told me has sounded like a train whistle. Other people have indicated that their tinnitus sounds like crickets chirping, or even a static or whooshing sound. So, for many, many people, tinnitus sounds like ringing, but if you are experiencing this perception of sound that isn't present in the environment, but your sound sounds like crickets or a static noise, that is still considered tinnitus.
Yeah, I think that's probably an important message to convey is that, regardless of how you experience it, it's still tinnitus. And probably the parting message is that um if you are experiencing it, there are tinnitus experts out there who you among them know quite a bit about this condition and can offer help.
Right. So if you are one of the 15% of people who are experiencing tinnitus that is causing a disturbance in your life, you should speak to a tinnitus expert sooner rather than later just to help you discuss, your management options, and sort of what level of tinnitus are you experiencing? What type of interventions would someone in your position likely benefit from? Sometimes people just need a little bit of background about their tinnitus, excuse me, and understanding what tinnitus is. And other people need more specific interventions to help them through their tinnitus journey.
Super. Okay. That's a fantastic message, Beth. Thank you for your time today for this topic. And I think we've answered, what is tinnitus, and there's some nuance there, but no matter how you're experiencing it, there's many others who are experiencing it too. And there's people who can help. So thank you for your time.
Thank you, Neil.